Hello everyone and welcome. Today we'll be diving into a complex and often overlooked condition, radiation nephropathy. This is a kidney disease that arises as a consequence of radiation exposure, typically during cancer treatment. We'll explore its causes, how it affects the kidneys, how it's diagnosed, and what can be done to manage it. So, let's get started. Radiation nephropathy, as the name suggests, is primarily caused by exposure to ionizing radiation. This often occurs during radiation therapy targeting cancers in the abdomen, pelvis, or even the thorax if the kidneys are inadvertently within the radiation field. The amount of radiation the kidneys receive, known as the radiation dose, is a key factor. Higher doses increase the risk and severity of kidney damage. Factors influencing the risk also include the fraction size of each radiation treatment, the overall treatment time, and whether chemotherapy or other nephrotoxic drugs are given concurrently. In rare cases, exposure to radiation from environmental accidents or nuclear events can also lead to radiation nephropathy. At a fundamental level, radiation nephropathy arises from damage to the intricate structures within the kidneys. Radiation injures the endothelial cells lining the blood vessels, the glomerular capillaries, and the tubules. This leads to inflammation and scarring, known as fibrosis. Endothelial damage causes a decrease in blood flow to the kidneys, leading to ischemia. The glomeruli, the filtering units of the kidneys, become thickened and less efficient at filtering waste. The tubules, responsible for reabsorbing essential substances and excreting waste, also become damaged, leading to impaired kidney function. Over time, these changes can result in a progressive decline in kidney function, eventually leading to chronic kidney disease. Determining the exact epidemiology of radiation nephropathy is challenging because it often goes underdiagnosed or is attributed to other causes of kidney disease. However, studies estimate that a significant proportion of patients receiving abdominal or pelvic radiation therapy develop some degree of kidney dysfunction. The incidence varies widely depending on factors such as the radiation dose, the volume of kidney exposed, and individual patient susceptibility. Children and individuals with pre-existing kidney conditions are generally considered to be at higher risk. As cancer treatment modalities evolve and become more precise, efforts are being made to minimize radiation exposure to the kidneys and reduce the incidence of this condition. The signs and symptoms of radiation nephropathy can be subtle and often develop gradually, sometimes months or even years after radiation exposure. Early symptoms might include fatigue, mild swelling in the ankles or around the eyes, and increased blood pressure. As the disease progresses, more noticeable symptoms may appear, such as proteinuria, which is the presence of protein in the urine, indicating damage to the glomeruli. Hypertension becomes more difficult to control. In advanced cases, patients may experience symptoms of chronic kidney disease, including nausea, vomiting, loss of appetite, shortness of breath, and generalized swelling. It's important to note that these symptoms can be nonspecific and may overlap with other kidney conditions, making diagnosis challenging. Diagnosing radiation nephropathy requires a careful evaluation of the patient's history, including their radiation exposure, along with a thorough physical examination and laboratory testing. A key diagnostic tool is the urinalysis, which can detect proteinuria and other abnormalities. Blood tests are performed to measure kidney function, including serum creatinine and blood urea nitrogen (SUBN) levels. These tests help assess the extent of kidney damage. Imaging studies, such as ultrasound or CT scans, can help rule out other causes of kidney dysfunction and assess the size and structure of the kidneys. In some cases, a kidney biopsy may be necessary to confirm the diagnosis and assess the severity of the damage. The biopsy provides a tissue sample for microscopic examination, allowing pathologists to identify characteristic changes associated with radiation nephropathy. Radiation nephropathy doesn't typically have strict classifications or distinct types in the way some other diseases do. However, it can be categorized based on the time of onset after radiation exposure. Acute radiation nephropathy occurs within a few months of radiation therapy, while chronic radiation nephropathy develops more slowly, often years later. The severity of the condition can also be graded based on the degree of kidney function impairment, ranging from mild to severe chronic kidney disease. Treatment and management of radiation nephropathy focus on controlling symptoms, slowing the progression of kidney disease, and preventing complications. Hypertension management is crucial, often requiring multiple antihypertensive medications. Angiotensin-converting enzyme ACE inhibitors and angiotensin receptor blockers are commonly used to protect kidney function and lower blood pressure. Proteinuria is managed with similar medications, as ACE inhibitors and ARBs can reduce protein leakage in the urine. Dietary modifications, such as limiting sodium and protein intake, may also be recommended. In advanced cases, dialysis or kidney transplantation may be necessary to maintain life. Additionally, addressing any underlying risk factors, such as diabetes or high cholesterol, is essential for overall kidney health. Preventing radiation nephropathy is paramount, especially in patients undergoing radiation therapy. Careful treatment planning is essential to minimize radiation exposure to the kidneys. This involves using advanced techniques such as intensity-modulated radiation therapy, IMRT, and image-guided radiation therapy as IT to precisely target the tumor while sparing surrounding healthy tissues. Monitoring kidney function closely during and after radiation therapy is crucial for early detection of any signs of damage. Protecting the kidneys by using radioprotective medication may be used during or after radiation exposure. However, evidence is limited. Educating patients about the potential risks and symptoms of radiation nephropathy is also important, so they can report any concerns to their healthcare team promptly. The prognosis for radiation nephropathy varies depending on the severity of the condition, the time of diagnosis, and the effectiveness of treatment. Early detection and management can help slow the progression of kidney disease and improve outcomes. However, in some cases, radiation nephropathy can lead to end-stage renal disease, requiring dialysis or kidney transplantation. Research is ongoing to develop more effective strategies for preventing and treating radiation nephropathy. Studies are exploring the use of novel therapies to protect kidney cells from radiation damage and promote tissue repair. Additionally, advances in radiation therapy techniques are continually improving the ability to deliver radiation more precisely and minimize exposure to healthy tissues, including the kidneys. Thank you for joining me on this exploration of radiation nephropathy, and I hope this has been informative.